So a definition, I mean, there are a few definitions of telemedicine that exist, but essentially it is the delivery of healthcare using tele or digital communications technology, where provider and patients are separated by distance. So, I mean, even before the COVID-19 pandemic, yes, it existed for a few years now, but really with the COVID-19 pandemic, yes, its use has really expanded and exploded globally. So it's due to its natural ability to provide access and continuity to care in an era of social distancing, and also because of the need to provide care, there is a temporary lifting of payment-related and regulatory restrictions. So similarly at NUH in urology, we have an established telemedicine program for the past 3 years for a select group of renal colic patients. But with the onset of COVID-19, we have seen our telemedicine use increase to about 5 to 6 times from baseline. Next, please. So, I mean, broadly, we can classify telemedicine or telehealth into a few uses. So teleconsultations is probably what we are most used to. So it's an interaction between a provider, doctor, and patients for the purposes of providing clinical care. Then in telecollaboration, these would be interactions between providers, either on-site or off-site for clinical purposes. So these could include things like tele-rounding, tele-mentoring. So a doctor could be sitting in his office and then concurrently he's rounding a few locations at one time. And then telemonitoring is something that's quite exciting. It's basically a collection of biomedical data from patients using remote systems and transmitted to providers for monitoring purposes. So encompassing this would be things like tele-rehabilitation as well. And then as for tele-support, right, this includes the use of online services for non-clinical, be it educational or administrative purposes, to support patient and caregiver in the delivery of healthcare. So it would be things like patient education and support. Next, please. So if you look at what has been done in urology so far, I referenced this systematic review by Novara in European urology. So there hasn't been that many publications for telehealth in urology, about 40 plus, and it's in a variety of conditions and across all 4 categories. You see a urinary incontinence heading the list, followed by prostate cancer. So essentially, what it is that there is still a lot of work to be done for telehealth. Next, please. So if we imagine telehealth, right, where does it fit in, right? It's not just one portion of the teleconsultation, but we need to reimagine the whole patient journey with the possibility of multiple digital touch points. And these are already, some of these are already in place. So from the moment the patient experiences symptoms, they search on the net for a doctor or search about the symptoms, they get an appointment, then they chat with maybe somebody who can triage the symptoms, and then finally they get to see the patient, the doctor in person or remotely, followed by scheduling of an investigation, so on and so forth. So the whole patient journey, right, has multiple opportunities for digital touch points. Next, please. So certain other disciplines have really moved forward in this digital and telehealth. So a very good example would be in tele or dermatology, whereby in the traditional patient journey, it is a very long-winded process. They search for answers, they try some home remedies, then they think about whether they should see a healthcare provider, finally they see a GP, they try other creams, then they visit the dermatologist, finally they get some right treatment, then they decide maybe it's too expensive, I won't get it, and they delay further picking up the medication. Then they worry also about the reimbursement. Finally, because of the poor adherence, not sure whether the treatment works. So this is a long process. But if you look at a revamped patient journey using teledermatology, some of these processes can be shortcut by use of like internet, artificial intelligence technologies, chatbots, to get answers, telederm consultations to rapidly get access to specialist care, and only in this example, a small proportion would really have to see a healthcare provider. And in this, the benefits are both to the patients who get precise diagnosis and treatment solutions faster, improving their satisfaction rates, and as well as providers, they benefit from increased availability of resources, and they are able to see more patients faster. Next, please. So if you think about how telehealth can be applied in urology, what I'm thinking is, are there support mechanisms in terms of tele support for symptoms or syndromes? They are known to be difficult to manage. Things like chronic pelvic pain, bladder pain. These patients don't just come once for treatment, and they need a multi-pronged and multi-disciplinary approach to help them with their symptoms. And maybe tele support can help them with this. Similarly, overactive bladder. In terms of tele-monitoring, we already know about wearables that are becoming more and more prevalent nowadays, in terms of watches, and also both commercial and medical devices. So in terms of chronic conditions like lower urinary tract symptoms, prostatic hyperplasia, bladder spasms from overactive bladder, things like erectile dysfunction, are there diagnostics and wearables that patients can wear and use maybe an app to track, so that these can be shown to the provider for accurate diagnosis and for treatment. And in terms of tele-rehabilitation for urine incontinence, maybe there could be a device that the patients could attach to their body as a form of biofeedback and help them frame and help them control their bladders better after surgery or because of urine incontinence. Next, please. So another area would be in telecollaboration, where there is now the Hololens mixed reality headset, which can allow remote consultations during surgeries, emergencies, as well as education. So these are exciting times indeed for telehealth,